everyone, and welcome to this video cast for the 2023 JDR special issue on age and oral health, biological and social behavior perspectives. I am Paula Colombo from the Federal University of Rio de Janeiro, and I'm an associate editor of the Journal of Dental Research. Together with my colleague and co-editor, Dr. Vieira from New York University, we join you today to highlight a couple of studies reported on this special issue. As we all know, advances in socioeconomic and biotechnology development have contributed to the global health improvement and consequently to the increase in life expectancy. This unprecedented growth of the world's aging population poses critical challenge to all aspects of modern society, especially the healthcare and health-related quality of life. Holistic policy guidelines and actions have been designed to advocate and fortify health aging at multiple levels, including the promotion of oral health. Basic biology and translational research focused on deciphering the mechanisms involved in age-related diseases have been encouraged. Given the relevance of oral health aging as a critical component of the One Health strategy, this special issue brings together articles dedicated to recent advances in the behavioral and social implications of age-related oral diseases and tooth loss on many aspects of quality of life. Other studies reported potential biological and molecular mechanisms of cellular senescence that impact oral tissue and cell homeostasis, post-immune response, and cellular regenerative potential during our lifespan. Now I would like to invite our first guest, Dr. Aquino Martinez from the University of Wisconsin-Madison, USA, who authored the critical review entitled The Emerging Role of Accelerated Cellular Senescence in Periodontitis. Thank you, Dr. Aquino Martinez, for sharing this moment with us today. Cellular senescence is a central hallmark of the biological process of aging. In your review, you discuss how the interaction between a persistent dysbiotic biofilm and several risk factors leads to the premature senescent cells that alter the periodontal microenvironment, amplifying inflammation and tissue destruction. So first of all, I want to ask you, when did you become interested in cellular senescence research? And could you comment on the impact of these key senescence mechanisms summarized by the acronym altered periodontitis?
Mm-hmm. Thank you so much, Dr. Colombo. I would like to start saying that I'm a dentist and I'm also a scientist. I'm trying to understand how oral infections can affect systemic health. I'm a dentist, as I said before, and I got my dental degree in Guatemala. And then I went to Spain, where I obtained my PhD in translational medicine. During that time, my research was focused on how growth factors control mesenchymal stem cell differentiation in the context of bone regeneration. In 2016, I came to the United States to start my postdoctoral training. That was in Mayo Clinic, Rochester, Minnesota. I spent 3 years studying the molecular and cellular mechanisms driving osteoporosis. One of these mechanisms was cellular senescence. For me, it was really interesting because I realized that the etiology of periodontitis shares several features with the general framework of cellular senescence. And that was the reason because I started with the research of cellular senescence and periodontal disease.
Oh, excellent. So my next question is, in your opinion, what are the future clinical implications of targeting senescent cells as an alternative strategy for the management of periodontal diseases in the general population?
I would like to say that a really important concept here is that cellular senescence is the result of persistent low levels of DNA damage. Sublethal levels of DNA damage cause cellular senescence. although this damage can produce many changes in these cells survive, and they start to secrete different factors, and this can produce the damage in periodontal tissues. One of the questions you mentioned before was about the acronym ALTER. I use this acronym to summarize some of these features, and I think it's really easy to remember because ALTER is connected with the general effect of these cells. And the letter A in this acronym stands for accumulation. We know that senescent cells accumulate with age. We also know that the senescent cells and the process of cellular senescence can be accelerated by the chronic exposure to DNA damaging agents, such as certain bacterial products. The letter L stands for limit. Cellular senescence in some way also affect the process of tissue regeneration. Cellular senescence decreases the number and the function of stem cells and eventually can reduce the regeneration capacity of tissue. The letter T stands for transmit. Senescent cells can communicate the senescent state to nearby healthy cells, and this is called paracrine senescence. The letter E stands for exacerbate. And this is one of the most prominent features in senescent cells. They act as a chronic source of inflammation. Senescent cells act as a sustained source of pro-inflammatory cytokines. And this chronic inflammation is non-microbial. This chronic inflammation is the result of DNA damage. And in this paper, I emphasize that periodontal inflammation, once these senescent cells start to accumulate, this periodontal inflammation in general can be the sum of the bacterial triggered inflammation plus the senescent associated inflammation. And this is what I call the two-source periodontal inflammation. Finally, the letter R stands for remodeling. And this is another important feature of senescent cells because these cells display an upregulated and dysregulated metalloproteinase activity, and this can destroy the extracellular matrix. Consequently, the accumulation of senescent cells in periodontal environment can promote the destruction of the tissues by activating different mechanisms that we already know are implicated in periodontitis. In relation to the last question, in the medical field, there are many preclinical studies and a few clinical trials that demonstrated that targeting and eliminating senescent cells can have some benefits. Senolytic drugs are used to selectively kill senescent cells. Xenomorphic drugs are used to decrease the secretion of senescent-associated factors. One really important paper described that the targeting of cellular senescence can prevent age-related bone loss. And this was a really important paper in the field of osteoporosis. In periodontal research, we just have a few studies. In 2020, we published for the first time that senescent osteocytes accumulate in alveolar bone. And these cells can have a really important role in alveolar bone destruction because they act as a pro-inflammatory cells. And we know that that's not a common role of osteocytes. A different paper also published that the use of compounds that decrease the secretion of senescent-associated factors also decrease pro-inflammatory cytokines and the periodontal inflammation, and also improve the bone quality, alveolar bone quality in all mice. And that was really important because these studies are suggesting the same idea. I personally believe that cellular senescence and the premature accumulation of senescent cells in periodontal environment could be a new paradigm to explain the onset of periodontitis. And I also believe that cellular senescence could represent a new therapeutic approach to delay periodontal destruction.
Oh, definitely. I agree with you. And I think this is a whole new world that we're gonna start looking in the future for this research on cellular senescence, not only for periodontal diseases, but for so many other chronic inflammatory diseases that we know are also connected with periodontitis. So, right. So I want to thank you, Dr. Aquino Martinez, for your brilliant explanation and your great contribution to such an important topic that is related to human health. Thank you so much.
Thank you so much. Thank you. Thank you.
Next, I would like to invite the co-editor, Dr. Vieira, to introduce our second guest.
Oral health is essential for overall health and well-being across the lifespan, especially in old age. This special issue encompasses a collection of articles dedicated to recent advances in the behavioral and social implications of age-related oral diseases and tooth loss on several aspects of quality of life for adults as they age. Slack, Smith, and colleagues propose an eco-social and intersectional series and argue this series offer a way forward for improving oral health equity in older population. This synergistic, critical perspective revealed the need for broad, upstream solutions targeting structural drivers of health inequalities. Suchitra and colleagues propose recommendations for integrating oral health into primary care for older adults. The authors issue a call to action for progress on oral health in older populations through care models and electronic health records innovations, education, policy changes, and outcome-driven research. Mao and colleagues provide novel evidence on the social determinants of dental care access for all the Chinese immigrants in the United States. Their findings point to the need for comprehensive solutions beyond the medical realm to reduce risks of isolation and promote well-being in marginalized aging populations. Schoolbreds and collaborators performed an international consensus study to validate previously optimized guidelines in oral health care as a section of the Interray assessment system. Dr. Jim Weinstraub will also be presenting a selection of additional papers featured in this special issue. In essence, these articles present persuasive arguments and substantial evidence underscoring the importance of prioritizing oral health in the care of aging populations. I wish to extend my gratitude to the authors who have contributed to this special issue. Furthermore, I urge my colleagues to read these papers and to give greater consideration to addressing oral health care related concerns among older adults. Thank you.
Greetings. I want to start by congratulating our two co-editors, Dr. Wu and Dr. Colombo, and the JDR team for putting together this landmark special issue of the JDR. This topic has been understudied and is increasing in importance as older adult populations in developed countries continue to increase. This demographic shift brings lots of challenges for society and our healthcare system. Several of the papers in this issue present research demonstrating relationships between oral health and systemic health conditions, specifically studies of tooth loss and cognitive function. In the US, there are very few population-based longitudinal studies that include dental, medical, and lifestyle data. An exception is the nationally representative Health and Retirement Study. Using this data set, Jones and colleagues found edentialism and irregular dental care were among important predictors of cognitive decline. Wu and colleagues, using the same data set, found the co-occurrence of diabetes and edentialism lead to even worse cognitive decline among 60 to 75-year-olds than either condition alone. These findings are important because the prevalence of Alzheimer's disease and related dementia is increasing. These conditions significantly affect the quality of life and cost of care for affected persons, their families, and their caregivers. On the bright side, using data from Singapore, Kiyuchi and team emulated tooth loss prevention interventions that found preventing tooth loss could benefit maintenance of cognitive function. Similarly, Kuri and colleagues also used hypothetical scenarios that emulated tooth loss and found a positive relationship between number of teeth and social participation among adults in Japan. These studies highlight the importance of oral health, retaining teeth, and regular dental care to prevent cognitive decline and other conditions. The connections between oral health and brain health are important and need to be better understood as part of oral and craniofacial research. A similar topic, neuroscience, aging and oral health research, was featured in a 3-session meeting within a meeting at the March 2023 AADOCR and CADR annual meeting. The proceedings and extended discussion will be published later in 2023 in Advances, the e-supplement of the JDR. The full oral health and aging translational research spectrum from cellular and molecular approaches to delivery systems and health policies are represented in this paper. I want to encourage listeners to read the papers in the special JDR issue and the future Advances issue to learn more and become engaged in aging and oral health research. Neuroscience holds the promise of increasing our health span, including our oral health span, that is, years of disease-free and functional health throughout life. Thank you.
Summary. These articles present compelling arguments and evidence for why oral health should be a priority in caring for aging populations. Teeth and gums are vital, not just for eating, but for cognition, social interaction, and well-being, all of which decline with age, but can accelerate when our diseases are left unaddressed. Further data emphasize the multifactorial aspect of the aging process and provide a better understanding of an array of molecular mechanisms that impact oral tissue and cells homeostasis. These mechanisms may offer valuable therapeutic targets for delaying and alleviated age-related oral and systemic disorders to promote quality of life. Thank you so much for your attention, and we hope you enjoy reading this special issue.